Based in Ireland, the pharmaceutical company Shire has just received U.S. approval to market a new drug that could bring relief to those suffering from a genetic swelling disease. The drug has been approved in Europe 3 years ago, and the treatment could now generate nearly $200 million in sales for Shire over the next few years. Now, my guest is the CEO of Shire, Angus Russell. Good to have you with us. Thanks so much for joining us.
Thanks very much.
Explain a little bit about the different divisions of Shire for those that are not familiar. You've got two divisions that were predecessor to the addition that you just did, the Biohealing company. Explain a little bit about the genesis of the company.
That's correct. We IPO'd here in the US in '98, and at that time we principally had one business, traditional business in small molecule chemistry addressing ADHD and rare GI conditions of ulcerative colitis and Crohn's. And then about 6 years ago we added to that with another business that we bought out of Boston, which really focused on very rare genetic diseases that affect very small patient groups around the world. And as you said, most recently, we've just added a couple of months ago a third leg to the business, which is now advanced biohealing, which actually makes human skin from human cells to actually address diabetic foot ulcers.
Now, how did you settle on biohealing? Why was that a focus for the company?
You know, when you look at the incidence of diabetes, particularly here in the US, it's growing very rapidly. Even we were a little surprised at the market research findings. Right now, 30% of all Americans over the age of 60 have diabetes, and projection is within 10 years that'll be more than 50% of people over the age of 60 here in the US with diabetes. And one problem associated with diabetes is these foot ulcers, particularly in aging populations. Last year, 3 years ago, there were 60,000 leg amputations here in the US from those ulcers getting infected. Last year, up to 90,000, so 50% growth in just 3 years. So a very fast growing market with a high unmet need. These skin patches actually address these wounds, promote rehealing of those ulcers, and hopefully prevent infection and amputation. We actually have a technology born out of that acquisition 6 years ago in rare diseases, which is called fibroblast technology. Just really means growing more cells based on human cells. That's the technology that underpins this particular business in making this human skin patch. So it was taking our technology, bringing that experience to bear on this small, rapidly growing business in what I see as a very fast-growing market.
Well, you mentioned fast-growing market, but it is small right now. How has this changed the disposition of Shire since you've got those other two divisions?
Yeah, as you say, small now, not significantly. The product last year sold about $147 million. That would position it at about 4% of Shire's revenues today. So small yet, but I think the wider space here is known as regenerative medicine, and that's something that we in Shire see as a very fast-growing area right now, and one that will become much bigger in the future. Obviously, as now many diseases are being cured, people are living longer. I think one of the next frontiers is that, simply put, the body begins to give out on you and you'll need replacement parts. So new organs, new tissue, this is all part of this regenerative medicine space, and we're excited to make that first entry in that space.
Tell me a little bit about the new approval by the FDA on Firazyr. I know did I pronounce it all correctly?
Yeah, no, it's absolutely perfect.
Only because I'm listening to you.
There you go.
Why is this so critical to the company? Because, as I said, this was already previously approved in Europe.
Absolutely. Right now in the US there are some other drugs in the market, but the way this condition has been treated to date is through what we would call prophylactic or preventative treatments. Patients are infused very often in a hospital setting, and that's been a very good measure, but this disease is very unpredictable, very random in nature, and so even with that prophylactic treatment, patients still have these attacks. And so what we've brought to the market is, you may be familiar with something like the EpiPen for allergies. So this is a similar concept. This is a pre-filled syringe. It's something that patients will be able to self-administer, and they can carry it around, therefore, in their purse or on their person. And when they get these attacks at random, they can inject themselves and actually prevent what can be ultimately, in some cases, a fatal attack.
And the estimate $200 million in additional sales, when would we see that? When would that be realized?
It's probably reasonable over about a 5-year period, I think. But I was meeting with some of the leading doctors in this field earlier this week at our launch meeting, and, you know, they're telling us that this is a real paradigm shift in treatment. One of them went as far as to say this is the most meaningful product ever launched in this space. So, yeah, I'm going to watch with interest. In these kind of areas, drugs do take off reasonably slowly until more awareness grows. But, as I said, 5 years hence, I think we're going to be looking at maybe $200 million at least.
And how did you become the chief executive of Shire? How do you get into the pharmaceutical business?
Yeah, I started off life as a finance guy, as a CPA, and way back coming out of high school and going through college, I thought about being a pharmacist, and so having then changed path into a more business career with a CPA qualification, the opportunity arose to join a pharmaceutical company. So it was an ideal way of joining that industry again, and so I joined as a finance guy, but became CEO about 4 years ago now in Shire.
All right, I want to thank you very much, Angus Russell, joining us, the Chief Executive of Shire. Thanks very much for your insights and your time.